My name is Dr. Ekiria Chikule, and I'm the principal of the Institute of Hospice and Palliative Care in Africa. This is a training arm of Hospice Africa Uganda, and we are situated in Makerere. The Institute facilitates capacity building as far as palliative care service delivery is concerned. We train professionals and non-professionals in the delivery of palliative care. The Institute opened in 1993, and we were affiliated to Makerere University in 2003. We train, but Makerere University is the one that awards the qualifications. The National Council for Higher Education recognized us as a tertiary institution in 2009, and we are now working at getting a charter. The students are trained in various aspects of palliative care because research has shown these are patients whose illnesses are beyond clinical care and cure, and they have shown that they prefer to be looked after at home, especially if they know that there will be a team of health professionals that will support them.
Welcome to the story of African palliative care in Africa. My name is Professor Dr. Anne Merriman, and I am a professor in palliative medicine here in Uganda, but I also introduced palliative care to Singapore, UK, and UK to Liverpool in UK, and also to Nairobi Hospice, both education programs there and service. And we had to learn from our patients and families in order to train. And of course, Uganda was different to the other countries I had been in, so there was a lot of learning to be done by myself and the first people in our team. In 2000, international programs commenced, and that was a separate entity, which I will talk about again. But by 2003, the government has agreed to change a statute which allowed midwives to prescribe pethidine, to include nurses who've been trained in palliative medicine to actually prescribe morphine. And this really increased our services a lot because the doctors are so few and many of them are not trained in palliative care. Now we had real specialists amongst our nurses. And since then, palliative care has spread to 90% of the districts in Uganda. And this has really made Uganda a model as well as Hospice Africa Uganda. In 2009, we were recognized as a degree awarding institute, and we were able to start immediately from the bachelor's degree. And this has increased over the years, so that now it has increased to the master's degree and to postgraduate diplomas. And we hope eventually to be having PhDs from Hospice Africa Uganda. So for the moment, we want to carry on with our training, and we have reached through international programs 34 countries in Africa, where we have been in and trained, and also trained them online. Sadly, these countries are struggling just as we are because the finances went down throughout COVID, and the many other disasters that are going on worldwide need funds as well. So following justice, we have to understand that this is a problem now because palliative care still is not a specialty in many countries, including Uganda, but it is in Kenya and a few other countries, and we really need to pick up for that. But for the moment, our palliative care has really improved palliative care throughout Africa. Our vision of palliative care for all in need in Africa is now being realised. The word hospice and the word hospital come from the same root, which means hospitality. But hospitality seems to have disappeared from hospitals all over the world. Patients are now treated just as a disease, not as a person. We are following the actual speech of Hippocrates, who lived 400 years before Christ, and he said it is more important for the carer to know the person that has the disease than to know the disease that the person has. That means we need to know that person, and that is what we involve in palliative care. So this includes the the ethics of Hippocrates in the Hippocratic Oath, and also our ethos, which developed over that time. And the ethos has 3 pillars only. The first one is that the patient and family is the centre of all we do. We want to extend that to governments and people who make major decisions for people, because they need to have held the hand of the people who are going to be affected by any decisions that they make. And yet, many people sit in their offices, make decisions about what should be done without ever seeing such patients. So we want to bring that to their attention. So that's one of them. The second one is that we care for each other in our teams, that our team is a family, and that we help each other if we're in any problems. And certainly Hospice Africa does that. And we want to get that across to all the hospices that commence throughout Africa. The last one is that we work together with other organisations doing similar work. The Palliative Care Association of Uganda, which is doing wonderful work throughout Uganda, and the African Palliative Care Association doing great work also throughout Africa with the governments, were both started within Hospice Africa, and we need to work very closely with them as we move forward over the years. And this is done through our education services. So we need to bring this through to all the countries in Africa, and we thank everybody who has helped us for this, particularly the National Council of Higher Education. And with them, with their help, we hope soon to have a charter with them so that we can move forward even further. Thank you.
We offer several courses at the Institute, and these courses are offered using blended learning, that is online learning and face-to-face learning. Among the courses, we have Masters of Science in Palliative Care, and we have clinical placements are also part of this course. So after the face-to-face and then online learning, we also have the clinical placement. So the clinical placement applies to all our courses at the Institute. We also offer postgraduate diplomas in palliative care, among which are clinical palliative care, pediatric palliative care, psychosocial and spiritual palliative care in oncology, and a postgraduate diploma in pharmacotherapeutics. We also have a Bachelor of Science in Palliative Care, and this is a 3-year course, and we use the same training modalities. Those are the long courses that we offer. And the short courses that we offer include the Allied Health Professionals course for the non-healthcare workers like teachers, lawyers, and accountants. We also offer a short course on spiritual care for the spiritual carers, and then we also offer a short course on the community volunteer workers, and then also for caring of carers, so that the caretakers who are caring for patients can take care of them in their homes. We also train the traditional healers so that they are able to identify patients that need palliative care and send them for appropriate care. Thank you very much.
I am Dr. Agasha Doreen Birungi. I serve as the Chief Executive Director at Hospice Africa Uganda. Under training and education, Hospice Africa Uganda hosts the Institute of Hospice and Palliative Care in Africa, which is accredited by the National Council for Higher Education. The Institute trains in diplomas, degrees, and more recently a master's in palliative care in affiliation with Makerere University. The Institute has a governing council that is chaired by Professor Harriet Mayanja Kiza, and a number of the governing council members provide strategic leadership to the Institute for its advancement. Training in palliative care, education in palliative care is very important for advancement of the specialty, and we continue to invite interested partners and students and medical professionals to take up a career in palliative care. Thank you very much.
As an Institute of Hospice and Palliative Care, in Africa, we receive a number of students right across sub-Saharan Africa. And their welfare here is one of the most important things that we consider. We receive students from as far as South Africa, Botswana, up to Sudan. I particularly want to speak about the amenities that we have here for training. We have a well-resourced library, well-equipped with books and e-resources. We are also having a very well-equipped computer laboratory that offers access to the internet. This being a blended learning mode, we try as much as possible to make sure that students have access to internet and a computer. We have a well-resourced clinic that has all the amenities that we need for our clinical rotation for our students. And we have a morphine production unit. We are the only place in Uganda that reconstitutes morphine. And we are doing this on behalf of the country, on behalf of the government of Uganda. That morphine is distributed all over the country to all health facilities, be it government or private. And we have e-resources. We have access to Hinari, which is a well-resourced source of information for our students. We also have an approved IRB that approves studies in palliative care. And this is one of the few approved IRBs in Uganda. We've been in existence for the last 8 years with this with this IRB in its current state. So the Institute of Hospice and Palliative Care is organized in such a way that a student is exposed to each and every material or resource that they need to enable their learning.
Enrolling for the training at the Institute of Hospice and Palliative Care Africa is the best professional decision that I've ever made in my life. The Institute has a special focus in equipping students with practical skills on how to take care of patients with life-limiting conditions. The program is carefully packaged in a manner that it enables us to overcome challenges that we face in our organizations back at home, so that we are able to remove all barriers that affect provision of care to those who need it. This program is not only interesting, but it's also delivered by a team of highly qualified professional members of the faculty. It is facilitated through an existing and a very easy to access Moodle platform, which is flexible, integrated, and interactive learning solution.
I did my bachelor's degree in palliative care at the Institute, and when I found the teaching and learning processes were very interesting, I had to come back for master's. So lecturers at the Institute of Hospice and Palliative Care in Africa are very supportive of the learner. And then the other interesting bit is the Moodle virtual learning platform, which is a real-life learning classroom environment. So the teacher can upload assignments, can upload course content, and then through the same platform, the learner can do the assignments, upload, and then the teacher can mark, grade, and give comments. And then the other interesting component I've found at the Institute is the mentors-mentee program, where each student is attached to mentors who support him or her through the learning process. So these mentors understand the students' challenges, they understand their objectives, and then they support them through achieving the objectives.
Good day all. I'm patient sample, a nurse attached to the palliative care unit in our country, Sierra Leone.
My name is Anne, Dr. Anne Abiola Ubena. I'm a hematologist from Lagos University Teaching Hospital, Nigeria.
Hello, my name is Senat Kasa. I am from Ethiopia.
So this Institute of Hospice and Palliative Care that is based at the Hospice Africa Uganda is indeed the center of excellence for palliative care training in this region, and I strongly recommend it for any healthcare worker who has a desire to attain a specialty level of palliative care training.